I want everyone to close their eyes for a moment and think of a song, just one, that completely changed how you felt the moment you heard it. Maybe it slowed down your breathing. Maybe it made you cry. Maybe it made you feel, for the first time in a long time, like everything was going to be okay. You can open your eyes now. That feeling you just felt, it's not nostalgia. It's not coincidence either. It's your nervous system responding to sound. And I think it's one of the most powerful things we're not talking about in today's mental health crisis. Here's the world we're living in right now. According to the World Health Organization, over 1 billion people worldwide are living with a mental health disorder. Yet 85% receive no formal treatment due to cost, accessibility, or social stigma. In fact, in the United States alone, nearly 1 in 4 adults are unable to access treatment due to financial constraints. This crisis is especially concerning among youth. Recent surveys show that nearly 4 in 10 high schoolers experience persistent feelings of sadness or hopelessness, and about 2 in 10 have seriously considered attempting suicide. At the same time, suicide remains one of the leading causes of death, with research showing that unregulated stress, anxiety, and emotional dysregulation can significantly increase suicidal risks and behaviors. And while traditional music therapy can be life-changing, it's often inaccessible to those who need it most. According to a 2025 report by Simple Practice, the average cost of one therapy session in the United States is around $100, making long-term care financially unaffordable for many. And globally, the crisis is much more severe. According to the United Nations International Children's Emergency Fund, many regions face a critical shortage of mental health care providers, with some regions only having one psychiatrist for hundreds and thousands of people, and in certain regions in Africa, only one for every million. These statistics reflect the magnitude and urgency of this crisis. But for me, this crisis isn't just reflected in numbers, it's also personal. After the birth of my younger sibling, I saw something change in my mother that I didn't exactly have the words for at the time. The joy was there, but so was something else. Something that didn't live. Looking back at it now, what I was seeing was consistent with postpartum depression, along with persistent stress and anxiety that didn't fade over time. I didn't exactly know how to help, but I noticed something. Whenever my mother listened to music, something inside her changed. Her breathing slowed down, her shoulders relaxed, the tension from her face lifted. Nothing else could do that. Not conversation, not rest, but music. And I couldn't exactly figure out why. I've always loved music, and I've always been a bit obsessed with technology. And at some point, those two ideas came together in my mind, and I started asking a question I couldn't shake. What if what happened in that living room with my mother didn't have to be by accident? What if we could actually build that? Before building it, I wanted to do some research. Music has been used as medicine for thousands of years. Ancient Egyptians used it in healing rituals, Greek philosophers wrote about its power over the soul, indigenous cultures all across the world use rhythm and song to help regulate stress and process trauma. It isn't New Age stuff, it's ancient human knowledge that predates modern medicine by millennia. And neuroscience is finally catching up to what our ancestors figured out intuitively. Music directly influences the limbic system, the part of the brain that processes and regulates emotion. It changes cortisol levels, it affects heart rate, and it lights up the same reward pathways as food, warmth, or human compassion. Music doesn't just feel therapeutic, biologically, it is. So here's what I couldn't understand. If music is genuinely this powerful, why does music therapy in 2026 still look the same as it did 70 years ago. Now, to be clear, music therapy is a legitimate clinical practice, and in many cases, it can be highly effective. But it also faces real-world limitations which are hard to ignore. For many, access is limited. Therapy sessions require trained professionals, structured appointments, and ongoing costs that can make long-term care hard to maintain. And globally, availability is even more constrained. In many regions, there's simply not enough trained mental health professionals to meet demand, leaving large populations without access entirely. And when music therapy is available, it's often not deeply personalized or responsive in real time, depending rather on human interpretation instead of continuous emotional feedback. These limitations don't make music therapy ineffective, rather they make it inaccessible at the scale this crisis demands. And to me, that felt like a problem that was worth trying to solve. But before that, I dug a little deeper, and I found out that your emotional state isn't just a feeling in your head, it's a signal, and it shows up at multiple places in your body at once. It's in your face, in the micro-expressions that flicker before you've even consciously registered an emotion. In your voice, in the way pitch, pace, and stress changes how you speak. In your skin, in the tiny electrical fluctuations in your galvanic response that directly track with your nervous system in real time. And in your heart rate, that tells a completely different story when you're calm versus when you're not. The key insight that changed everything for me was this. If you look at all four of these signals at once, you can understand someone's emotional state at a depth that no single signal can give you. And if you can understand someone's emotional state in real time, you can respond to it. And that's exactly what I spent the last year trying to build. A system that can do exactly that. Using AI to detect someone's emotion from these four signals, and then generate music and visuals based on the user's preferences and based on their emotional state in real time. The music changes as the emotions change. The emotions change as the music changes. It's a continuous loop, and it never stops adapting. And I called it Harmony, a harmonically adaptive, real-time, multimodal output for neural integration. Now, I want to talk about something that I think is lost in conversation often. We often talk about the mental health crisis in terms of what we don't have. Not enough beds, not enough hospitals, not enough funding, not enough therapists. And all of that is true. But in all this talk of what we don't have, we've overlooked something that's been there the entire time. Music has crossed every border humans have ever drawn. It survived every empire. It exists in every culture, every era, without a single exception. And quietly, without being asked or being prescribed, it can help people feel less alone, less frightened, and more like themselves. But what we've never done is taken it seriously enough to be intentional, smart, adapted to the person who really needs it. And that's what I wanted to create. Not as a replacement for the current mental health system, but as a solution that can reach the 1 billion people the current system doesn't. I keep coming back to that same living room. My mother, a song playing, and a smile spreading across her face. I was a kid. I didn't really know what was going on at that time, but I just knew that it was real, that something was happening that I couldn't explain, but I couldn't dismiss either. Because at the end of the day, it is just that. A room, a song, a person who needed it, and music finding them anyway. 1 billion people worldwide need something to find them. I think we've had the tool all along. We just need to use it seriously enough to build it right. Thank you.